And just want to make sure everything's working. All right, it looks like we're good to go. So welcome everyone. Thank you for being here. I'm going to just give you a quick little overview of some of the Zoom things that we have going on today. So as we've been doing much more distance communication and everything, we have probably, a lot of you have experienced using Zoom. The webinar is a little bit different. If you haven't been in any webinars, the features are slightly different. So you'll notice that as participants, you're not able to unmute or to share your video. And that is so we can have our panelists focused and sharing during the webinar today. And that's who will be broadcasting. You can enter questions, and we have two ways of doing that, either in the chat or within the Q&A. We'll also share some resources in there, and you can see Nicole has shared, let's see here.
Sorry, I was just addressing the questions about the timing. So just reiterating for everyone that it is 11 to 12. The webinar links just open up a little bit early to let people on. So just trying to clear up that confusion. So that was all.
Thank you. Yep, I've had several emails on that as well, and I'm going to keep working through those, so I'm sure that we'll have people joining. But all of our webinars that we've scheduled with the series are from 11 to 12. We have the link is open at 10:30, just so that people have some time to get in and check on making sure that everything's working. And so our panelists have time to set up and make sure that everything's working on our end. So sorry about the confusion on that. Every webinar will be 11 to 12. We just open up the link early so that everybody can log in. I think that is it for announcements. We'll put the links for the YouTube channel in here again, so that if you want, you can get to that. And otherwise, I think I will hand it over to Nicole.
Great. Well, thanks everybody for joining us today for the First Steps Pathway to Playing, Learning, and Growing webinar. And as Erin said, I hope that you'll all be able to join us for future webinars, and we have that information for you at the end of the presentation. And for anyone who registered with your email, we will be sending out a copy of all of the slides and the recording as well after the presentation. So if there's any questions on that. But just to get started, my name is Nicole Burning. I am the clinical lead on the Early Intensive Developmental and Behavioral Intervention Benefit at the Department of Human Services. And now I'm just going to let some of my colleagues on our interagency team introduce themselves.
I'll just jump in quick. So I'm Erin Farrell. I'm the ASD specialist at the Minnesota Department of Education.
I can jump in next. I'm Dr. Jennifer Hall-Landy from the University of Minnesota. I work in early intervention and early developmental delay. It's nice to have everyone here today.
I can jump in here. My name is Tammy Childs, and I am the statewide specialist at Metro EXU, which holds a grant from the Minnesota Department of Education. And I'm the statewide specialist for autism spectrum disorders and other health disabilities.
My name is Elise Holmes. I'm with the Minnesota Department of Health, and I'm our early childhood specialist with the Child and Family Health Division.
I'm Kim Hicks, and I am the EIDBI policy lead with DHS.
So just to go over our agenda for today, we are going to start by answering what are some of those key developmental milestones that we should all be aware of and looking for, and then why are developmental milestones important to track, and why are they important for families to be aware of and to be tracking as well. And then we'll go through how we can help identify and achieve some of those developmental milestones in young children, and then where families can go if they have any concerns about their child's development, and who else is available in the community to help support families. And then we'll open it up for discussions and questions. But if you do have any questions throughout, please feel free to send those through the chat and we will get those answered. So I will turn it over to Jennifer to get us started.
All right. Thank you, Nicole, for that nice introduction. And before we get started today, I wanted to share a little bit about our Interagency Team. We are a group of state partners from state agencies and the University of Minnesota, where I come from. All of us work together. We partner, collaborate. We focus on ways to integrate services and supports across systems so that we're providing the best possible services and supports for Minnesota children and families. So each of us, each agency is represented here today. My colleagues are here from Minnesota Department of Human Services, Minnesota Department of Health, again, the University of Minnesota Institute on Community Integration, where I work, the Minnesota Employment and Economic Development, and the Minnesota Department of Education. And again, all of us are working together to help make services more integrated and connected across systems. Next slide, please. So today we're going to talk a lot about developmental milestones. And we get a question a lot, what are developmental milestones? Well, the way I look at it, the way I talk to families about it is we see developmental milestones broadly as the way children play, learn, act, move, and grow. We know that every child is unique and they'll learn at their own pace, and that children develop in different and similar ways. Developmental milestones include those markers we all know in development, like a child's first step, a baby's first smile, waving bye-bye, first words, all of these things that parents watch for with our children. We call those developmental milestones. Next slide, please. So here's a resource that we have. You can get this from Help Me Grow or any of the state agency websites. It's the First Steps Pathways to Playing, Learning, and Growing resource. And this is a resource that helps guide you on a developmental journey, what you should be expecting your child to do at each of these ages. It's a wonderful tool. It's a great tool to review before any type of a well baby visit, but it really takes you with each of the steps that a child should know as they learn and grow. Next slide, please. All right. So why are developmental milestones important to track? Well, any of you that are parents or work with children in the age group of birth to 5 know that it's a time of tremendous change and growth. So tracking these developmental milestones with your child, it can really support your child as they grow. You can identify the ways they may need help to learn, if they need a little extra help, how you can support healthy development for them. We always say, don't wait. Early intervention programs can make a very big difference in the life of a child. So 1, we want you to monitor development, celebrate those milestones, but 2, act early if there are any concerns, because there are a lot of resources and supports out there to help you as a parent. And we're going to talk about those today. Next slide, please. So how can you help your child achieve their developmental milestones? We get that question a lot from parents, and things that you do every day help support your child's development. Some basic things that we say is talk to your child, read to your child, sing songs during a diaper change. Simple everyday acts help support your child's development. Model simple words or phrases for them to help their language development. And when you're reading or when you're at the grocery store, point out and label pictures, items, so that the child learns vocabulary. Simple games like patty cake and peekaboo teach your child great social interaction skills and really allow other people to support your journey in parenting. It's a big job, it's an important job, and really accept support from other people in helping your child develop and grow. Next slide, please. So here are some free resources we want to share with you, and we'll chat some of these into the chat box as well. An excellent resource that you can get free online is the First Words Project. You can do a screening online and see how your child's development compares to other children their age. You can learn about activities that you can do as a parent to help stimulate language development, as well as support early developmental learning. Today, we're talking a lot about children age birth through 5. So you're seeing these websites will all really focus on these early years because they're such an important time for child development. Next slide, please. So this is a program that I do a lot of work with. It's called Learn the Signs, Act Early, and it provides a lot of free resources. And I'm going to tell you at the end how you can get these resources. They're resources that help you, again, track your child's development, understand what your child should be doing at specific ages. If you see, this almost looks like a board game up here. It gives key developmental milestones at each stage that you can watch for and track. And it's a wonderful resource. We have these in posters as well that we use in waiting rooms and places like that. So parents can see, what is their child's development? What should they be expecting at specific ages? Next slide, please. A wonderful free resource we have is the CDC's free Milestone Tracker app. You download it on your phone. It's free. There are not advertisements. We have it in English and Spanish. Parents love this resource. Again, it's an app on your phone. You put in your child's name and age, and you can track what they should be doing when. It lets you know when well baby visits, when the timing should be for well baby visits, some potential questions you could ask your healthcare provider. It helps you track milestones. It gives you developmentally appropriate activities. It even has videos you can link to see what you should expect your child to be doing at certain ages, as well as lots of parenting tips and activities. I will put the link in the chat when I'm done, but if you look here, if you go to cdc.gov/milestone tracker, you can download the app, and it is a wonderful tool, and you can download for as many children as you have. Parents really love this resource. Next slide, please. We also have free developmental storybooks for children. These are storybooks that parents, teachers can read to children. Baby's Busy Day, here we have on the left of the screen, talks about development for 1-year-olds in a story. So it tells a story about a 1-year-old that you can read to your baby. It is a board book. And then it talks about developmental milestones you should be expecting to see. The same with Where is Bear for 2-year-olds, and then Amazing Me for 3. Some Screen at 3 programs give out the Amazing Me, It's Busy Being 3. Some healthcare providers give these out at well baby visits. These books are free, and they are a wonderful tool for parents, teachers, really anyone. We love giving books away for free, and I will put in the chat how you can order those for free. You can go to the CDC website. You can also get them from Help Me Grow. Next one, please. All right, here's the website of how to get free materials. Visit CDC Act Early, click on free materials. You can order a whole host of materials. You can get a resource kit, you can get books. These are all wonderful tools for tracking your child's development. Next slide. All right, with that, I'm going to turn it back to Erin, who's going to walk us through some of the other tools that we have. Thank you.
Thanks, Jen. So we just wanted to highlight there are so many resources that are available to really help guide you in your pathway to services, which we'll highlight a lot more in our next webinar as well. But this gives you a little bit of an overview of, you can access some of these by having a conversation with your medical provider, with your child and teen checkups, and then the follow along program, as well as what Jen was just highlighting with Act Early. We also have a lot that is connected within our early childhood family education. When you access, services through early childhood, you do get a lot of other support and information about screening, as well as information with Help Me Grow and connecting through educational services and the medical diagnosis, which we'll also talk a lot more about in our next webinar. We just wanted to highlight here that there's a lot of different ways for you to access services, whether you're going through your educational pathway or through having those conversations with your medical provider. There's also information on how to access some services through county agency or tribal offices as well. And all of these materials that we're sharing with you are made accessible and are posted within the Minnesota Department of Human Services website and the Minnesota Autism Portal. Next slide.
Erin, just before we move on, we did have a question that I think maybe you could help address. So the question was, some school districts are no longer testing and serving children under the primary category of ASD before age 6 or 7. Rather, they say developmental Part C or Part B only. So what is your maybe take or opinion on that?
So this is, I think, a question for a longer conversation, and I'd like to maybe hold that one to the end. But just as kind of a general answer, districts really do have the power to make their own decisions with how they do things. But what we're doing with the Department of Education and through our Autism Interagency Group is we're really stressing the importance of early intervention, early detection. And we are doing that through disseminating all of this information that we're sharing with you through the webinar series, but also talking with school districts and making sure that they know the importance to act early and support families in their journey as early as possible. All right, and then I think I will hand it over to Elise on this slide.
Yeah, so as Erin mentioned, there's kind of a lot of different doors if maybe a child isn't meeting those milestones that you might think they would, and you have some questions. In terms of first steps, these are a couple of the health resources that are mentioned on that page. So the first would be some sort of screening or monitoring. And these programs are really they're not meant to label or put a diagnosis on a child. They are screened. So it's just a tool that kind of helps maybe just take a cursory look at what's going on. And the first of that would be the follow along program. That is a program that happens through 80 of the 87 counties in Minnesota, and it's through our local public health department. The way to enroll in that is just to go online, and again, the link is posted on that sheet. And you enroll, you put in some information about your family and your child, and you'll receive some sort of periodic either emails or phone, or you'll receive an email, phone call, or a paper screen in the mail, kind of depending on how your county does it. And you'll fill those out, send them back to the local public health nurse, and they'll give you a call and let you know, hey, everything looks good, or hey, I have some questions about this. Additionally, if you have any questions about your child's development, then they're willing to talk with you about those on the phone, answer anything that you may think might be concerning. The other place you can go is child and teen checkups or your child's pediatrician. So child and teen checkups is a state program for well visits or well baby visits, well child visits, those typical checkups that you have throughout a child's life. And that's the Medicaid associated program and what that's called. But again, if you have any questions about developmental milestones, the type of development that you're seeing in your child, or any concerns you might have, or any differences you see, a great first place to have that conversation would be with your child's pediatrician or family practice doctor. They use these screening and monitoring tools, the same ones in the follow along program as it at your doctor's office, just to look for anything that might be out of the ordinary. If anything is concerning, either from the local public health nurse, from your child's pediatrician, or just you personally are concerned about something, that's when they may take a next step into referrals and evaluation. And as Erin mentioned, we're going to talk a bit more about that in future webinars. But just as like a cursory look for referral or evaluation, that's just taking a closer look. Again, it's not about just putting a label on a child, but knowing that a diagnosis can be helpful and open up the door to services. And there are a couple of different types of evaluation that sort of might be recommended by your child's pediatrician or from your local public health nurse. So they may look into a couple of different things, or you can personally request from your doctor or your health provider to look into these types of evaluations. You can go to the next slide. And these are a couple of trainings and resources. So we have some developmental and social emotional screening trainings, as well as a screening sort of fact sheet for providers. And these are great for primary care doctors, as well as our, physician assistants, nurse practitioners that are doing some of these different things. We also recommend a number of these screening trainings for local public health nurses. We know a lot of other folks are doing developmental screening, like our partners across the agency in the Department of Education, as well as with Child Protective Services, are doing a number of these screenings. So those are available online. Our family home visiting program, also done through the local public health department, conducts a number of different trainings on the ages and stages questionnaires and the ages and stages social emotional screeners. Great, and I'll pass that on to our next panelist.
I'm here today to talk about educational resources, and we are very committed, as you can see in this webinar, to making sure that caregivers and providers are aware of all of the resources that are available to you. But I wanted to specifically talk about educational resources because this is something that is provided at no cost and does not require any medical documentation or diagnosis to be able to enter the system. So the Help Me Grow Minnesota, as Jen mentioned, is a website or a phone number that you could call. It's kind of an entry point to finding out about resources and being connected with your local school district. So what happens in the educational system is you're always connected with your local school district. So you can call your local school district directly, or you can go through Help Me Grow. And this is from ages 0 through 21. So I just wanted to make sure that people were aware of that. You can also engage in early childhood family education services. This is through your district's community education program, and there may be a fee for this program, but this is for all families. It doesn't provide specialized services, but it certainly could be the door to looking at specialized services. So, and just to be clear, this is of all the resources that I'm going to be talking about, this is the only early childhood family education that that there may be a fee for. Next slide, please. So in talking a little bit more about Help Me Grow Minnesota, it's basically again, entry point or the connection with your local school district. So families or providers can certainly call their local school district directly themselves, or they can go through Help Me Grow. So once that happens, your local school district, based on your individual situation, will provide evaluation and intervention services, and this starts from birth. It's important to know that this is free to all families, regardless of income. And you can visit here, helpmegrow.org, for more information and resources that are designed specifically for different groups, including parents, caregivers, and professionals. Help Me Grow also really wants everyone to know that any concern that you have about your child's development would be a reason that you could certainly contact them. Next slide, please. We're going to be talking about this more in future webinars, but I just wanted it to be clear to people who may have concerns about a child or a provider who might need to understand a little bit more about the educational system, is that there are services provided through your school district from birth to 21 for students who have educational needs and qualify for either early childhood special education services or once they enter kindergarten, special education services. And the nice thing about connecting through your school district is you will have a team and a case manager that will help you navigate services. They can help you access other services and resources that we're talking about here today. And as Jen said, you don't want to do this alone, but involve other people. And just to be clear, the law does require school districts to provide all students with a free and appropriate public education. So here you can see what those services look like. Now I'm going to hand it over to the next speaker.
Hi, this is Kim. And we are going to talk a little bit about the Early Intensive Developmental and Behavioral Intervention, also known as EIDBI. EIDBI focuses on early intervention services and requires what we call a CMDE, which is a comprehensive evaluation of a medical diagnosis, if it's appropriate. If you think EIDBI might be a good fit, you can see all of our wonderful providers at the Minnesota Healthcare Program Provider Directory, and we've included that link. If you want to learn more about EIDBI, there's a wonderful online training that you can just click on that link. It'll take you directly there. You don't need to sign in or do anything else. And the training talks a little bit about EIDBI, but it also talks about other opportunities for services and supports for families, including things like access to medical care and other community-based services. EIDBI services may be eligible for They're eligible for all medical assistance programs, but also may be an option depending on your private insurance. So we encourage people to contact their insurance provider and ask questions. You can also contact your local county or health services office to receive more information about different childcare, financial resources, or other things.
Great, perfect. So, and I think what we wanted to reinforce throughout the presentation is that there are a lot of different ways that families can access services and support. So whether it is through their local clinic or healthcare provider, or whether it's through the school district, or whether it's through a community-based provider, or if they come out into the homes like a service like EIDBI, and you can access all of those things together or one of them individually, but just making sure that providers and families and everyone is aware that these are all available. And oftentimes, I mean, regardless of the diagnosis, that you can access these early intervention supports, and just how critical that is during those early developmental years. So really, regardless of what type of diagnosis it is, if there are any types of developmental delay, just making sure that we are getting families access to these types of services and supports right away. And so if anyone is wondering about how services are being provided right now during COVID-19, we do still encourage you to try and schedule those well child visits, those well child checkups. Get your child in for those developmental screenings and immunizations. Still during this time, certainly taking any health precautions. A lot of times right now, doctors are scheduling telehealth visits with families. So if you aren't comfortable going in, but just making sure that you are still tracking those milestones, using a lot of those tools like the Tracker app that are online, and then looking into programs that are being offered. So local community education programs that are maybe being transitioned to online right now, and just looking into what programs and services are being made available to you in your specific region of the state. We also have a list of resources on the Minnesota Autism Resource Portal that really combines all of the different educational, health, human service resources for families at this time, and what you can be looking for and what you can access during the COVID-19 peacetime emergency. And then we've also provided some of the distance learning and disability services guides for families, and the case manager guidance as well, since I know we likely have some case managers on the line as well. So those can really help you to, again, explore what additional options are out there. It's always important to be looking at the wide range of resources available, but I think this time especially has really shown us that being able to access supports across a variety of places is very helpful. And then just for those additional ways that you can be supported within the community, so we wanted to point out a couple advocacy organizations that help families. So there's a great organization called Family Voices of Minnesota. They pair any family of a special needs child with other families that have special needs children, and help them to answer questions, navigate the system, and just really kind of go through what your next steps are. And we also have a support group page on the Minnesota Autism Resource Portal that has a number of different opportunities, as well as regional supports. And then some advocacy organizations, the ARC of Minnesota is a great one. And we also have additional groups listed on the website as well. And if you all ever have a resource or something that we should add to the portal, we also have a way for you to submit that resource to us under the Contact Us information on the portal. So this is what the portal looks like. It is just a website with all of the different information across our organizations, all compiled into one place. So we hope that no matter what your role is, that you're able to navigate through the website and find the information that you're looking for, and know that it is a trusted resource, that it is either, you know, a state agency program, or it's something that we've partnered with an organization in the community that can be trusted. We also recently launched a Facebook page to go along with the Minnesota Autism Resource Portal. So we will be posting updates and information that way as well. So we encourage you to check that out and follow us for future information. And then this is just the list of all of the upcoming webinars where we'll dive a little bit deeper into some additional topics. Just to remind everyone, those are all 11 to noon, and you can register for those that are coming up. And then we do have the first steps documents, and they are translated into Hmong, Somali, and Spanish as well. So you can use the links here to find those. Otherwise, going on to the Minnesota Autism Resource Portal, you can find that. We really encourage you to print off the resource or send it out to families electronically, really just helping to get this information into the hands of those that need it. So I see that we've received some questions online, and I'll read them off, and then whoever would like to jump in and help answer those, please do so. So I see.
Before we start the questions and answers, I was just going to say, I think we'll stop the recording and sending to YouTube. Basically, just kind of wanted to bring it all back together with this group, and just to say, you know, the purpose of these webinars is to make sure that people have access to the services and know where to find them. And so we're really trying to just get the messages out with all of the different ways that you can access services, and make sure that that you're supporting individuals on any level. I would like to say thank you to all of my interagency partners. This is a wonderful group that we have, and we will also add our contact information in when we end this recording as well. And don't worry, we're not leaving. I'm just going to stop the recording so that we can